Welcome everyone. This is Swati Naraganti, the writer at Urzu, a venture of Think Roman Ventures, and welcome to the special session. It's my great pleasure to invite and introduce Dr. Sree Bhushan Raju, a distinguished leader in nephrology and the professor and head of the Department of Nephrology at NIMS Hyderabad. So Dr. Raju has been serving at NIMS since 2002, following his DM in from AIMS New Delhi, and is a recipient of prestigious Professor H.L. Trivedi Gold Medal, a prolific researcher and a principal investigator for Indian Council of Medical Research. So Dr. Raju has published extensively and delivered over 1,000 lectures, raising awareness about kidney health. And he's a person of unique combination of clinical expertise and healthcare management skills, and significantly involved in advancements of nephrology care, research, and educations. So, Dr. Raju said, we are thrilled to have you with us today and look forward to gain valuable insights from your remarkable journey. So, could you share the pivotal moments in your journey which inspired you to specialize in nephrology to pursue further in this field?
The nephrology is the one like that. I should thank you for inviting me and having me here with you all today in this interview, very interesting interview. And to take an interview of mine, who is a simple government professor in a teaching institution here in Hyderabad, and as if we have done something good or achieved something good. So when you sent a questionnaire to me, then I realized that we have done something good to the society. But being in a government teaching institution, we always feel that we are serving the people and we are very happy about it. And we are more teaching the students, and that's also we are very happy about it. But when we somebody recognizes that, we feel even more happier that somebody has
Yes.
recognized us for our good work and all. No, but though they are very simpletons in the society, but somebody recognizes a simple good work also is a something like an achievement we feel. So thank you for that and for making me feel happy in this
No,
evening. And
pleasure to
thank you very
having
much.
you here.
And as far as the nephrology is concerned, every general medicine resident feels that the nephrology is the one subject which is very closer to the internal medicine. Internal medicine is a branch of medicine which encompasses probably the every part of medicine as such. And there's no other specialty in medicine which is very closer to the so-called internal medicine. So if you are a good physician, then only you can become a good nephrologist. So by being studying nephrology alone will not really make you a good physician. So that is the one. So that's why we do our MD medicine days, though cardiology, neurology, and there are and not only that, actually, most sought after branches after internal medicine to do any super specialty courses. But we chose nephrology, which is an upcoming branch that time around 25 years back.
Okay.
And not many seats were also available in this country, even despite having a very difficult and tough entrance examination to get into major institutions in the country like All India Institute of Medical Sciences, Delhi, PGI Chandigarh, CMC Vellore, and several other teaching institutions in the country. So despite that, we chose nephrology, and we are very happy for that. That we could serve a large group of people, with especially when the kidney diseases, the prevalence of kidney disease is increasing alarmingly in this country, especially involving the youngsters as well as the elderly population. So that's why we are more concerned about the society as far as the kidney disease is concerned. And we are trying to do our best by serving in the teaching institutions.
It's great to have a professors of like-minded people who thinks like we need to give for future students as well. So I'm a person who's still afraid of nephrons and internal activity or osmotic pressure. So it's great to have you as a professor in nephrology, sir. It's really a good thing. So now, have you had so much mentorship experiences? So what do you think plays the most important role, like strategies which can make the students understandable about the empathy of the patients and also knowledge about the studies?
Actually, most of the students, they don't expect the professor to have a lot of knowledge in every aspect of it. In fact, I always feel that, like one of the statements of Mahatma Gandhi, which I always recollect in his own autobiography, he wrote in his my experiments with the truth. He was probably was teaching some students in South Africa those days, and one of the statements given by him is that, despite my colossal ignorance, I was considered as one of the good teachers around. That's why the teachers students were coming to me. Even I feel number of times that the two teachers have their own deficiencies and they can never be a perfect teacher. It is the responsibility of the student to extract whatever he can, the maximum from the teacher. So we have our own deficiencies. We can never be perfect, and we cannot be good with each and every student also at the same time. And with the same student, we cannot be good with every time in the similar fashion. So we try to be sometimes very good, sometimes very bad, sometimes very rude, sometimes very harsh, but very sometimes very compassionate, sometimes very empathetic, and sometimes very loving, and sometimes very caring. And but the knowledge, as far as the knowledge is concerned, we have to upgrade ourselves along with the students. The students should feel more comfortable and uh, concerned whenever he approaches the professor, and the professors have to train them, not to give them a feedback, spoon feeding of some knowledge, theoretical knowledge, and all other things. Probably rather how to deal with the case and how to take a proper history and how to examine, how to analyze the history given by the patient and how to manage the patient, especially in critical situations, and especially more so when the patient has got a varied complications and various disorders associated with the condition. These are very important in a very medical professor to understand. And similarly, the students also should understand that it is not just a learning from straight from the the professor, but it is also learning from different angles and extract whatever is the best out of your teacher and learn and keep up with yourself and try to learn along with your professor. So, medical profession is something different, unlike other professions where the teacher will be constantly teaching the student, or probably the feeding the knowledge to the student, and the student will perform only in the examination at the end of that course. But here in medical profession, the student will be teaching a lot, and he will be presenting all the cases. He will be presenting the seminars, journals, and we'll be learning out of them. And we try to correct them, and we'll add a little bit of our experience to them rather than trying to correct them totally. And most of the times, the most of our students, being a super specialty students, will be very good
Okay.
and very knowledgeable also. And there may be some lack of maturity or a lack of understanding, and sometimes a lack of analytical capacities in a given situation. So
Okay.
we try to add a little bit to that, not more than that. That's why every student should approach the professor with a lot of comfort and genuinity, and also a little bit of respect also at the same time.
Yeah,
So
sure.
that's why I'm very happy as a teacher, and I have students so far. And across this country, my students are spread, and in several parts of the world also my students are there, and I'm very happy for that. That they mentoring the student is one of the best things happened to me in my life, and I always feel great about my teachers as well as my students from whom I have learned a lot. Of course, the patients are always there for us in the medical profession, who will be teaching us constantly.
Yeah.
And added to that, the wonderful teaching institution, there have learned a lot from both from my teachers as well as the students.
Okay. So teachers are everyday learners, and besides theoretical practices to the students, we need to train more analytical skills as well. That's a good insight from your end, sir. And this is a developing era for the healthcare and also the patient need approach it. So with the growing prevalence of kidney diseases, how do we ensure that patient care remains at the forefront of the clinical innovation? How do you we take decision based on the patient centers? So how do you ensure the decisions here?
See, as you stated clearly, that number of patients are also increased in our country.
Yeah.
And the patient basically not only has the disease, but a lot of ignorance also. And
Okay.
that a part of the management also equally important for the doctor. So first of
Okay.
all, we should make the patient more comfortable, that there should be a development or build-up of rapport between the patient and the doctor, and try to dispel the ignorance of the patient initially, in the initial
Okay.
few things. So that's why I say, that when we take the history, the patient should understand the way we are asking the questions, that, what is the cause of the disease, what is the symptoms, and what is the treatment, 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 and what is the treatment uh, that these are the important things in his life to understand. For example, if I ask him that what are all the symptoms of your disease, and have you ever had this? Have you ever had this? Were you ever been told about this particular thing like this? And what were the investigations that time? And have you read your investigations? And did you feel that there's something abnormal in that? Anybody in your family has got a similar kind of a disease? And did you develop these kind of features in the childhood? And have you taken any of the tablets? These kind of examples of these particular tablets, did you ever take them? So while asking the questions, the patient also should understand that these are the important things which he should understand and which are already done by some other doctor outside. And you know that most of the specialty doctors are, super specialty doctors are the tertiary care centers. And they are the ones who will be seeing the patient after so many investigations done by the other doctors outside.
Okay.
So we should not really go through the investigations first. Let the patient be comfortable in the environment, because every patient will be afraid of not only the doctor but the hospital environment per se. So we should make them sit comfortably and ask so many questions in such a way that you're not just investigating them. It is not something like the interrogation. It is more like a routine and comfortable conversation between the doctor and the patient. Then the patient also simultaneously will be understanding that these are the important things we should look at it. Okay, he may not be knowing a correct answer immediately. For example, if I ask him that you ever had this similar kind of a complaint in the childhood? And the patient need not really answer immediately, that he might not really remember, recollect each and everything immediately. And next day, whenever he comes, then he will come back and he will tell us, saying that, Dr. Saab, I had this particular problem in the
Yeah.
childhood at the age of 4 or 5. I vaguely remember I cross-checked with my mother, and my mother told me that I had this particular swelling of the entire body, and I was taken to a doctor, and I was given some drugs with which I poured out a lot of urine. Then the course was given for 3 to 4 months. Then I became okay, and I visited the doctor 3 to 4 times later, and I forgot and I missed. So now I came to you only after so many years. So this is a kind of a thing which we hear, which we see routinely. That's why by conversation with the patient also, it's something like a teaching the patient that what are all the things, important things as far as health is concerned to them. And they will go out and inquire in the similar fashion. That's how a simple science spreads. I feel very comfortable in talking to the patients like that and analyzing the history then and there itself, and telling them in such a way that how to analyze their own health aspects
Yeah.
and what are the important things we should monitor. They should monitor regularly. So this is the way we should really spread the science and know so much of a theoretical knowledge, technology, and these things. A simple ordinary patient, they don't really bother much about it. But still, they should be able to understand their own body and how the body is manifesting various diseases inside in the form of symptoms. He should be able to understand them and tell them. That's why most of my patients, when they come second time or third time or 10th time to me, they talk almost in the scientific knowledge, the language, which I feel very comfortable and good.
Okay. So communication and comprehension of the patient's awareness are all the main things which we need to take care while treating the patients. It was a good, insightful advice here. So, like, as you have been the public vocal healthcare voice in the in the prevention of and early detection of non-communicable diseases, what systemic changes do you believe are essential to achieve this? To let the patients or public health know what about how to prevent this non-communicable diseases or how to maintain those without much worsening stages.
Yes, being in a tertiary care hospital, looking after a super specialty department like nephrology, where we get to see a lot of people coming with an outcome of the so-called non-communicable diseases, something like hypertension, diabetes. We don't see the young early stages of diabetes. We get to see the patients who for the first time detected of hypertension. Okay, we have good number of patients who come to us within a few weeks after being detected to have hypertension. But only thing is that we see the outcome of that in the form of a kidney damage. We see the patients in the form of heart failure with a kidney disease, in the form of a stroke with a kidney disease. So these are the outcomes of non-communicable diseases. Previously, when we were the students, we were told that these kind of non-communicable disorders are predominantly seen in the elderly population, especially after 50 years of age group. Now we have been seeing, unfortunately, in a very young age, with the 20s and 30s, and having hypertension, diabetes. Not only the development of hypertension, diabetes, occurring in an early age, but at the same time, the complications of it are seen in very rapidly in a quick fashion. Something like previously we used to see patients with hypertension developing a hypertension and diabetes in 50s, developing complications out of the diabetes and hypertension in 70s. But now we are seeing in 20s and 30s, within few years, 4 to 5 years after that, they started having complications related to diabetes, something like diabetic kidney disease, diabetic retinopathy,
Yeah.
diabetic neuropathy, hypertension related kidney disease, and heart failure and all. So it's very, very alarming that the society is actually getting into such a turmoil. And probably as it is affecting the youngsters, we should be able to take care of that. Not only the patients and the general population, public, but it is the policymakers at the administrative level, both at the center and the state government level, health level, they should be able to tackle the situation. Luckily, Government of India has taken several measures to make the people understand about non-communicable diseases like hypertension, diabetes, obesity, and several other manifestations. And even at individual level, we should be able to take care of ourselves, especially the children. They should know how to do good physical activity in the form of exercise or yoga, and how to prevent long-term complications, especially the primordial prevention of diseases in the form of cutting down the salt, doing physical activity regularly, and having an adequate amount of sleep, taking the food in a proper time. All these things are very important for the children and the youngsters to inculcate in their day-to-day activities. It's very important. It is responsibility of one person. For example, a young fellow has a disease
Okay.
with secondary to hypertension. At the age of 30, 32, he loses the kidney and develops into some heart disease. It is his responsibility to make the family members understand that the hypertension in a young is not an ordinary disease, and it probably ultimately culminates in damage to an important organs like heart and kidney, brain, etc. And similarly, the family members of such a patient also should spread the knowledge in the form of saying that, telling everyone around that hypertension and diabetes can occur in a youngsters and can lead to a devastating organ damage over a period of time. So that's how the people will understand. Making a day-to-day activity a daily habit of good physical activity, and then a sufficient amount of food and sufficient amount of water and the sleep are very, very important in our making our life healthier. So non-communicable diseases, most of them are ultimately secondary to the lack of this particular healthy lifestyle among the youngsters. And being youngsters, being the building the society in a proper way, they are the most important and crucial productive age group of our country. So we should be able to take care of them and tackle them so that they'll be healthy, so that they can serve the society in a much better way.
Yeah, so nutrition should be taking place first rather than the taste of the food, and regular accommodations of healthcare, even it's minute, as you said, salt intake should be reduced in hypertension patients. So all these minute lifestyle changes can make a big improvement and outcome as well. It's a good thing, sir. So can you mention few alarming symptoms or any other thing which can help us to identify the nephrological worsening for a patient, sir?
The growing weight in a short period of time, that weight
Okay.
gain is very important, that they should understand that gaining weight in a short span of time of a year or so, which is three major organs in the body is concerned. The second one is the diabetes. A more important thing is the hypertension, diabetes. Any of the family members has gotten any non-communicable disease in the form of obesity, hypertension, diabetes, early kidney disease, premature coronary artery disease, that is occurring a heart attack in the father and mother in less than 50 years of age group, and person having their own habits in the form of a smoking and alcoholism, they should be able to go to a doctor very frequently. So this is one thing that can really make them better as far as the health is concerned, and they should be able to tackle the complications also much easier and better as they grow in their life, and provided they detect the problems very early and try to cut down the complications related to that. So a good healthy lifestyle. You're able to hear me?
Yes, sir, I do. I can. So, yes, sir. So, I'm a personally a research-driven passion enthusiast, like a passion-driven research enthusiast. Sorry for this. And I have gone through your ICMR projects and Google Scholar, every project, and your research has garnered an international recognition. So, could you elaborate on a study or a breakthrough that has or had the most profound impact on nephrology, sir?
In fact, as such, we have been doing well, we are not supposed to show much interest in only one aspect of it, but
Okay.
rather we should be able to show our interest in aspects of the subject, unlike in a practitioner where they can show predominantly depending on the type of cases which they get, either a part of the subject. For example, the nephrology, some people will be interested more in acute kidney injury. Some people will be more interested in dialysis. Few people will be interested in transplantation. And that would in dialysis, many people will be interested in peritoneal dialysis and some people in glomerular diseases, something like that. Being a teaching institution, we are supposed to tackle each and everything, and we have a huge number of cases, and we are supposed to demonstrate our enthusiasm and interest in each and every aspect of nephrology. I cannot restrict myself to a part of a nephrology curriculum where my students may not be liking it. I'm supposed to spread the things entire in its entirety to all my students so that they can choose and pick up whatever the part of nephrology they can like. So
Yeah.
similarly, my enthusiasm initially was more towards epidemiology of the chronic kidney disease initially when to start with, through which we got an ICMR funded project. We have done such a project across 9 major cities with the
Okay.
help of ICMR funded project through All India Institute of Medical Sciences, New Delhi, through my mentor, Professor Sanjay Agarwal. And then we have done similar kind of studies with a cluster sampling of analysis. We found that a good number of the patients, knowingly or unknowingly, are having a kidney disease in the country, and 9 major cities have been evaluated and screened. And we found that almost 8.9% of the patients, people in our country, are having a kidney disease, both knowingly or unknowingly, which is almost similar to most of the countries in the world. But a major breakthrough in this particular study is that we are the one people, ours is the study which evaluated the creatinine, the kidney markers, 3 months after again, because you know that the chronic kidney disease cannot be told by looking at one number at once. We are supposed to recheck it again after 3 months in such a way that the disease is confirmed. And there may be number of instances where the kidney disease can be a transient phenomenon that is called acute kidney injury, and that cannot be considered as a chronic kidney disease. So we wanted to truly check like a chronic kidney disease in such a way that we checked the kidney function markers 3 months later in the same patient. And we found that the 8.9% or approximately 9% of the people in our country have got a kidney disease, which is alarmingly high when compared to several other developed countries. So we are supposed to uh, publicize this particular entity both at the public level as well as the policy makers level in such way that they can take better policies on par with other major disorders in the form of coronary artery disease and the cancer, etc. So it is very important for us. As far as our other aspect is concerned, that being in a developing country, and that too we are working in a resource limited centers like government teaching institutions. We have our own limited resources, and we cannot really spend a huge amount of money for each and everything. So we have done some kind of studies where the major part of the transplantation is is the cost of therapy. So we have done few studies where the without a major treatment modality called induction therapy in transplantation,
Okay.
and some patients with induction therapy in transplantation. We have done a good study which was published in Indian Journal of Nephrology, that without an induction also patients could really could get their kidney function properly after transplantation. So this is one of the best things which I feel very satisfied that it gave something to the organizations where the money is a very important factor. Not everybody
Yes,
can
yes.
afford the transplantation, and most of the times it is out of the pocket, spending money out of the pocket by most of the people in our country. Not everybody has got insurance, and not everybody can go to corporate hospitals. Most of the people, 80% of people in our country, they go to simpler hospitals and the teaching institutions and the government hospitals. And transplantation has become an unaffordable entity for many,
Yes.
and because of the money only, they could not really go for transplantation. So these kind of an issues, which can really enlighten the doctors, nephrologists, that without an induction therapy, which is like very expensive therapy, without that also patients can really do well. And our experience really has gone well into the nephrology community. And good number of the government centers would really adopt our technique of without an induction doing the transplantation. And despite that, they're getting a very good results out of that in transplantation outcomes. So this is one of the things. And we have done good number of studies related to glomerular disease,
Okay.
especially the one related to IgA nephropathy, which is the most common glomerular disease across the world, and also in our country, which has actually, which is the number one culprit in damaging the kidneys, especially among the youngsters.
Yeah, it is.
So we have done good number of the studies and through the government funded projects. And we were actually trying to get the pathophysiology, especially in our group of people live in South India. And
Got it. Yes, yeah. Please go.
so similarly, we have done good number of the studies related to major glomerular disease, membranous nephropathy, IgA nephropathy. Not only that, the diabetic kidney disease with the help of several sponsored projects, which are also equally important. So we have contributed immensely to those particular projects, especially some of the path-breaking trials like Credence and Visionary trials, which are which have made an impact in the management of patients with the diabetes as well as the glomerular disease called IgA nephropathy. So our group of people are something different in India and especially South India. Ethnicity makes a big difference as far as the management of the patients is
Yes.
concerned. Not everybody responds equally in the world as far as the management with some drugs is concerned. So individual genetic morphology, individual genetic architecture also makes a difference. In transplantation, we have done some of the studies related to how a genomics of one particular drug called tacrolimus can make an impact in the outcome of kidney transplantation. So we have evaluated that, and we both tacrolimus as well as the mycophenolate are the important drugs that will be given to all the patients of kidney transplantation in the world. So we have done some genomic studies related to this particular uh, patients, and we found interesting and important results. And which we have done it. This is ours is one of the earlier days we have done these particular studies. Now everybody is able to do that over a period
Okay.
of time. And similarly, we have been doing good number of the studies related to the lupus nephritis and IgA nephropathy, membranous nephropathy, and other glomerular diseases, especially the genetic disorders. We are trying to concentrate on trying to link the various genetic disorders, and especially in the children as
Okay.
well as the adults with the glomerular disease, how the genetic morphology can really make a difference in them. So probably over a period of time, we can actually come out with our data related to the patients from South India. So interesting thing is that most of our studies are actually limited or restricted to our own clinical aspects. We don't have any laboratory of our own where we can do something like a research, which most of the clinicians in America and other countries, they do that. And they have their own laboratories. And major part of the research will be done in the laboratories for which they are attached in part of their tenure. And sometimes the clinical work, sometimes the research work they do together. But we have to do most of our work is related to the patient care and the clinical work rather
Yeah,
than
it
the
is.
research. So research we do simultaneously, and we'll be adding a little bit of our clinical experience to that. So the world should really look at us in a different way. They don't have to see the way they see a researcher in the United States of America or United Kingdom or even Japan or even for
Yeah.
that matter, even China. So we are the clinicians, we are taking care of a lot of patients. Our experience, however little it maybe it will add late greatly to the clinical science, which the people, the world should understand. So we, the clinicians in our country, in a country like India, where we add a lot of our clinical flavor to the research. So we don't do the basic research, which in the laboratories will be, it will be done in the laboratories, which we don't really do that. But as far as my clinical research is concerned, I'm not totally satisfied so far, but we probably the best research probably would be coming in the future. and it is probably yet to come. And we have made some inroads into such a wonderful research aspects through our research, small research team I have in my institute with the 5 or 7 people. And we have been doing some good amount of research. And with so many of my students and the faculty who are associated with me since a long time, and we'll be able to do wonderful research in the due time in the next couple of years. And probably one of the best outcome from
Okay.
our clinical research projects would come in the future.
I'm very much excited to see the future upcoming work, which has a profound impact on social health care, sir. And as you have said, the cost factor analysis, which is a major hindrance for the lower class family and as well as the middle class family. The induction experiment or the research which you have done significantly had a profound impact on the healthcare. It's great to have you as a researcher in the nephrology here. And like thank you for being here. So, in your vision for nephrology, could you mention what are the most pressing challenges in today's nephrology, and how do you foresee the research addressing this in the next decade, sir?
So every patient the is afraid of one term called dialysis. So the
Okay.
moment we say that your kidneys are failed and you are supposed to go for dialysis,
Yeah.
they'll be frightened by the term dialysis because they would have heard a lot negative about the dialysis term and the impact on individuals' family, personal life, economic life, and everything. So similarly, transplantation also. Unfortunately, transplantation has got limited resources in our country, either be it either living related or disease donor transplantation. Living related, over a period of time, the new families have become nuclear, and the less number of people are there in the family, like only 2 children, and both the parents probably sometimes can have a diabetes and hypertension, or they may be elderly, and the brother and sisters, the blood group do not match many a times. And the other one who can give the kidney in our country is the wife or the husband, and sometimes the relation may not be appropriate and good between them, and the blood group also doesn't match. Mostly it is unrelated, though legally it is acceptable. And unfortunately, the disease owner transportation in our country also did not really pick up. So patients are searching for different varieties of resources to get transplanted. That includes an illegal way of getting transplanted. So
Okay.
these are the two major issues which I feel. One is the dialysis that can be made more economically viable and affordable to the people across the country. Luckily, many good number of the states have got a free dialysis therapy,
Okay.
especially the National Dialysis Program and individual programs like Aragasri and other things in our state of Telangana and Andhra Pradesh. And there are several states have got a free dialysis program, but it's not reachable to each and every one. Unfortunately, most of the centers are related to the major cities, and people have to come and travel a long distance to reach the dialysis center. And if they get into any complications, they'll not be able to go to the hospital in time.
Yeah.
So that's why most of the patients succumb to the complications during dialysis. So my vision as far as the dialysis is concerned, a simple way of technology which they can do at home, and they can monitor their own complications, and they can come to the hospital as and when required. This is the one probably in nearly next 15 to 20 years it might happen that most of the patients on dialysis can be taking dialysis at home comfortably
Okay.
without major interventions by the doctors as well as the in-hospital kind of a therapy. So that's one. Second one is the transplantation. The more and more disease donor transplantation in our country can really help the poor, especially the people who are waiting on dialysis for a long time. And we have a very good system in our country, and we are more compassionate about helping others, however bad in the situation we may be in. So we always try to help the people who are actually on the deathbed, especially when they are brain dead. The family members can really take a decision of donating his entire organs, which are important, which can really save 8 lives after the donation, be
Yeah.
it 2 kidneys, one heart, liver, lungs, cornea, sometimes even some other organs like even hand, uterus also being tried. Even the
Okay.
skin banks are there in our country, which can be taken from a deceased donor. So similarly, these kind of things should happen more frequently, and no organ should go wasted in our country because there are so many lives are dependent on such people who can really do well if they get transplanted with an organ, be it either kidney, heart, or lung, or liver. So similarly, that organ transplantation should be more easier and affordable to the people. And now the
Yeah.
organs transplantation is a very expensive process, especially
Mm.
liver, heart, and lungs, compared to the kidney. But that also should become more affordable in the future, and a more and better immunosuppression, which can really sustain them for a long time. So we have patients of kidney transplantation for more than 30 years, doing very well now. And similarly, other organ transplantations also doing very well. So not every patient is actually lucky enough in sustaining life after transplantation with immunosuppressive protocols. So we should get such an immunosuppressive protocol, which can be a simple drug and which can be taken easily and affordable to the people also at the same time, and which can sustain their life for a long time without any major complications. So this is every nephrologist's dream, not only my dream, every
Okay.
nephrologist's dream. Let our dreams come true one day, that the patients not only get in a easy and comfortable way of dialysis, and they can get transplanted easily, and they can sustain their life beyond kidney failure with both dialysis as well the transplantation. And similarly, like most of the patients, they don't want dialysis and transplantation also. They want a magic pill which can
Yes.
really relieve them of their kidney failure. So hopefully, with God's grace and the blessings of the science, one day we might get such a wonderful drug which can really make their kidney healthier and happier, so that they can lead a comfortable life.
Yeah, all these talks and insights will be helpful for the upcoming researchers who are focusing to become their PhD journeys or postdoc journeys. So this was invaluable research gaps which we need to address as well, sir. So as we are at the end of our talk, as a reader in nephrology, I would like to know what is your message for patients, for researchers, and for broader healthcare community about the future of kidney care.
As for the patient is concerned, I request them that they should be able to detect their symptoms early, and they can reach up to the doctor and be methodical and disciplined in their disease course. Okay, the
Okay.
diseases will be bad only. The disease can never be good to the people.
Yeah, it is.
And it is our responsibility to see that we are good towards the disease. For that, a discipline is very, very important. I feel a good number of people are not disciplined. They don't understand their own disease. As such, they don't understand their own body also. At least
Yeah.
from the day they're detected to have some kind of ill health, be it either kidney or any kind of a disease, they should start understanding their own body, and they should keenly observing their own body and go to the doctor whenever they see a little bit of change. Moreover, there should not be any technical and practical and administrative issues hampering their good health. So they should be able to take care of all of them. They should know when they should go or where they should go in case of any
Yeah.
emergency, how to approach and whom to approach. These are very important. They don't really appear big, but they are very important.
Yeah, it
And a good
is.
number of my patients got into complications because of such a lack of communication. And be communicative to your doctor, and select out to the doctor who can be who can with
Answer
whom
all
you
your
can make a good
questions.
rapport,
Yeah.
and be in touch with. And yeah, not only giving us some soothing word, it is equally important. I say that, but it's very important for the doctor to make the patient understand that they have the disease. They should be able to accept it. Once you accept it, you will understand it better. If you don't accept it and in a denial mode, you can never understand things properly, and you can never have a foresight of your own life. So better to accept the disease and take it forward along with your doctor,
Okay.
and be good and sincere with your drug intake, and be punctual in attending the doctor as and when required. So this is what I appeal to the patients, and keep all the documents properly. Never ever think that this particular page may not be important to the doctor. This report is not really valid after 10 years or 15 years. Each and every document written by the doctor and given by the patient doctor in the form of report or the notes are very important. Every patient should document that, and digitalize it and use it whenever it's required. Most of the patients, they don't do that. I appeal to all my patients that every paper written by the doctor and every report given by the doctor should be digitalized and documented properly, and it's submitted to the doctor whenever it is required. And these particular reports are for not for one patient, but these reports are important for the generations to come even afterwards. That's very important. The second one, to the students and the nephrology residents, to learn nephrology to the maximum extent as far as the residency is concerned, and be compassionate to the patient, consider them as human beings rather than the patients, and be caring, and be approachable, and you should be empathetic, because the nobody wants a disease, and it
Yeah.
is we never expect us to get disease. But when we get a disease, and the society, the people around should be more kind and generous towards the people who are unfortunate victims of the disease, especially a disease like kidney disease, which is very slowly progressive and lifelong, and which has a lot of money involved, lot of emotions involved, and the family support is very important, and the social support is also equally important for such patients. So the doctor is plays a pivotal role, and he has to put all of them together, and he should be a good friend. He should be a family member of the patient, and he should be more compassionate and understand the patient first, actually. So that's very important. And having a knowledge is equally important, but every doctor is knowledgeable. I don't see that the knowledge is less in 1%, more in percent. It is not the amount of knowledge which the doctor has got, but how he approaches the patient in a
Yeah.
given clinical situation is more important. So that's for the pay doctors, and the society is concerned. And yeah, we should have, the society is changing a lot nowadays. Our day-to-day activities are really are our own drawbacks. So we are more comfortable with the life, but at the same time, that is actually taking a toll of on our health, and we are getting into most of the disease because of our own habits, especially the dietary habits, physical activities, and all other things. So the society should really get into such a thing where everyone thinks every day, at least for 1 hour, about their own health. So then only they can do well. Because being healthy is actually makes the nation also wealthy. It's not
Yeah,
just earning money by stock exchanges or bigger IT companies and big roads and bungalows and all these things. They really do not matter as far as the growth of a nation is concerned. It is a healthy society, the healthy generation, healthy youth is the major
yeah.
asset to the country. So I feel that the society should think
Health
about
is
health
wealth.
at least once a while, and our policies should be in such a way that to make the people, a common man also be healthier. So that's very
Yes.
important for us.
Yeah, thank you so much for being here and sharing insightful expressions from your journey and also for the researchers for upcoming generations, sir. It's pleasure to have you with us today.
Thank you. Thank you all.